First Lady of Kwara State, Your Excellency, Ambassador Dr. Olufolake Abdurazak, and also the chairperson of the Governor Spouses Forum, First Ladies of other states here present, the former First Lady of Kwara State, Her Excellency Mrs. Aisha Lawal, Kwara State Deputy Governor, Elder Kayode Alabi and his wife, Mrs. Tokunbo Alabi, members of the National Assembly here present, and their wives, Senator Sadiq Sulaiman Umar, Kwara North, Honorable Tolani Shagaya, thank you so much for being there. You've really sacrificed so much, especially with budget defense going on. We do appreciate that. Thank you very much. Coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate, CON, the wife of the Chief of Staff, Mrs. Salama Tugbajabi Amila, wives of honorable ministers here present, led by wife of the Honorable Minister, Mrs. Rachel Umai, Speaker of the Kwara State House of Assembly, Right Honorable Yakubu Danladi Salihu and his wife, and other members of the State Assembly here present. Secretary to Kwara State Government, Professor Maman Saba Jibril and other ESCO members. Wives, representatives of service chiefs and heads of security agencies present. Wife of the National Security Advisor, Ajia Zara Ribadu. Wife of the Director General DSS, Mrs. Betty Ajayi. Kwara State APC Chairman, Prince Sunday Fagbemi and Party ESCO members. Local government chairman here present. Executive Secretary, Organization of African First Ladies for Development, WAFLAD, Dr. Nados Behanu. Thank you so much, Dr. Nados. It's really great to have you out. You've enjoyed your stay so far. Our first time in Kwara State, and thank you so much. Development partners of HIV/AIDS here present, including UNAIDS Country Director, Dr. Leo Zekenj. I hope I pronounced it well. National Coordinator, National AIDS STD Control Program, Dr. Adebola Basharun. WHO Country Representative, Dr. Walter Kazadi Mulumbo. They thought you are from Kwara with your outfit. Director General, National Agency for Control of AIDS, Dr. Timitokbe Ilori. Representative of UNICEF Country Representative, Dr. Jerida Birukila. Friends of HIV, RHI, including Ajia Abu Ibrahim, Executive Chairman, Federal Character Commission, Dr. Muiba Dankaka. Director General Michael Umodu, National Institute of Labor Studies, Comrade Isa Aremu, MNI and his wife, Managing Director, Pract Oil, Ajia Bola Shagaya, MON, Vice Chairman, Transcorp Transnational Cooperation, PLC, Dr. Foluke Abdul Razak, OON, the representative of the Imperial Majesty of Ife, the Oni of Ife, his lovely wife, Oluri Aderunke Ogunwusi. So our best regards to Kabiesi, and I'm so glad you are here, and our royal fathers that are here, because you all have messages to carry to your domain for us. His Royal Highness Emir of Shonga, Alhaji Dr. Haliru Yahaya, our religious leaders here present, particularly the Chief Imam of Kwara State, Dr. Mohammed Bashiru Salihu, and Khan Chairman, Kwara State Bishop Sunday Adewale. We need all of you to carry this message as well, because if I didn't go to OFLAD and Isaka conference at Zimbabwe, I wouldn't have really understood the impact. Because for us in our 60s, we are thinking, oh, HIV/AIDS is done with. But you know, the staggering number, especially with our population, is what has brought us here. So we have to start the campaign again. I hope Professor Pate is in agreement. I'll do that in advocacy for you. Very well, I promise to do that. And the First Ladies of State, we've already briefed them. We are all ready, because this shouldn't be here. And you remember Winnie from USAID, UNAIDS, called us out, called Nigeria out in Zimbabwe. I can never forget. So that's why I'm really approaching this aggressively as I can. And with the permission of the Minister for Health, I'm going to try to do that. Our students and our youth, I'm so happy that you are here, because this message also is for you. Gentlemen of the press, this message too is for you. Distinguished guests, ladies and gentlemen, I'm honored to officially flag off the maiden edition of the Free to Shine campaign in Nigeria as I conclude my 3-day working visit to Kwara State. The Free to Shine campaign is an advocacy initiative of our African Union and the Organization of African First Ladies for Development, OAFLAD, and global partners to address the growing complacency in the response to the spread of HIV/AIDS in Africa, with Nigeria having the highest burden of HIV/AIDS in sub-Saharan Africa due to the size of our population. The burden is particularly high among children, youth, women, and marginalized groups. To complement the Free to Shine campaign, I've also decided to advocate for the triple elimination of HIV/AIDS, syphilis, and hepatitis by 2030. This campaign will be held across the 6 geopolitical zones of the nation. Today, we are flagging off the campaign for the North Central Zone in Kwara State. The Free to Shine campaign aims to significantly reduce the number of new HIV infections among women of reproductive age, prevent mother-to-child transmission of HIV, that is also the vertical transmission, and to guarantee that every child born with HIV receive the necessary treatment and support to thrive. According to the Federal Ministry of Health and Social Welfare, in 2024, there were over 140,000 children and nearly 2 million adults living with HIV/AIDS. Also, it is reported that most infants born to HIV-positive mothers are not tested within the first 2 months of birth, largely due to the fact that the mothers are not aware or they are ignorant of the consequences of their action. It is also heartbreaking to learn that just 2 years ago, 15,000 children between the ages of 0 to 14 months lost their lives to AIDS-related illnesses. Each of these children represented not just a statistics, but a future full of potential that was sadly cut short. The ongoing challenges faced by these children highlight the urgent need for sustained action to improve prevention strategies, diagnosis, and access to treatment. In Nigeria, hepatitis and syphilis are public health diseases of concern. As noted by experts, hepatitis, particularly hepatitis B and C, continues to pose a significant threat as it can lead to chronic liver diseases and even cancer of the liver. Syphilis, if left untreated, leads to miscarriages, stillbirth, congenital anomalies, neonatal and infertile deaths, amongst others. The goal of this campaign is to raise awareness, renew our commitment, and take collective action against these diseases. This, I believe, aligns with our shared vision of a healthier where every individual, particularly women, youth, and children, can thrive and live healthier lives. This vision is in line with the renewed Hope Agenda on health of His Excellency President Bola Ahmed Tinubu's GCFR, which focuses on health as an essential pillar of development. Nigeria is at the pivotal stage in our fight against HIV/AIDS and is poised and ready to join other countries in Africa who have achieved UNAIDS 95/95 target by 2030. The aim of this target is to see that 95% of the people who are living with HIV/AIDS know their status. 95% of those who are aware of their status are placed on life-saving antiretroviral treatment, and 95% of people undergoing treatment achieve viral suppression, which means they cannot transmit the virus to others. We must deepen engagement and traditional faith and faith-based institutions to address cultural, religious influences on HIV prevention behaviors, especially those engaging in birthing services, by expanding access to HIV testing services with comprehensive counseling, treatment, and care for all individuals who test positive. I thank all our health workers, the National Agency of Control of AIDS, NACA, and National AIDS and STDs Control Program, as well as research and public health institutions for their efforts in combating HIV/AIDS, syphilis, and hepatitis through the years, as well as global partners helping us in this fight. I especially recognize WHO, UNAIDS, UNICEF, UNDP, PEPFAR, and the Elizabeth Glacier Pediatric AIDS Foundation, amongst others. And I pray that PEPFAR will be back soon, and we appeal to President Trump as well to reconsider. We must intensify efforts to ensure that the global triple elimination target of HIV/AIDS, syphilis, and hepatitis is achieved by 2030. I believe with the concerted efforts of all our stakeholders here present, especially our state first ladies, who will help disseminate this message in their various states, and your husbands also supporting us. And we are glad that the 36 state governors are here in the person of Malam Ramani. Ramani Yi is seated. You see, when I mentioned the hunger, they were calm before. So they will be able to help us do that at the next meeting that they'll convene. So this deadline can be attained by the grace of God, and I rely on you all to do the needful. In the coming weeks, we would witness more advocacy in the media in all the 36 states, starting with the Federal Capital Territory, as we launch the Free to Shine campaign today. I appreciate the Executive Secretary of LAD, Dr. Nados Behanu, who has joined us today from Ethiopia. Thank you so much for all the great work you do for the organization. I hope you enjoy your brief stay in Kwara State. I know you're rushing back to prepare for our next meeting in AU in just 2 weeks. So thank you so much for coming. Finally, I thank our host, His Excellency, Governor of Kwara State, Malam Abdurrahman Abdulrazak, CON. And Her Excellency, the First Lady Ambassador Dr. Oluremi Abdulrazak, and the good people of Kwara State for the warm reception and great hospitality throughout our stay. Kwara is indeed the state of harmony. My heartfelt appreciation. I'm so grateful to you all. And Imam and the current president, please, HIV is still around us. We want a Nigeria that the citizens are all healthy and free and this is what we can all do together. God bless all our children, youth, and mothers. God bless Kwara State, and God bless the Federal Republic.